Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Common hospice meds increase death risk for Alzheimer's dementia patients. Break and number 148. Hospice drugs commonly handed out to people with Alzheimer's disease and dementia might be hastening their deaths, a new study says. Benzodiazepines and antipsychotics given to hospice patients with dementia appear to increase their risk of earlier death, compared to similar patients who weren't prescribed those drugs, researchers reported October 14 in JAMA Network Open. Dementia patients who began taking benzodiazepines were 41% more likely to die within 6 months, and those on antipsychotics 16% more likely to die, researchers found. And number 156, dementia is now the most common qualifying condition among hospice enrollees, yet many of these patients are not imminently dying, and number 157, said lead researcher Dr. Lauren Gerlach, a geriatric psychiatrist at the University of Michigan. And number 156, because prognosis in dementia is so difficult to determine, nearly 1 in 5 patients will outlive the 6-month eligibility window for hospice, and number 157, she said in a news release. And number 156, this makes it critical that medications used during this period enhance, rather than diminish, quality of life. And number 157. Hospice care was originally developed to help people dying from cancer, but has since expanded to ease the passing of people with other terminal diseases like dementia. The proportion of hospice patients with Alzheimer's disease or dementia has increased from less than 1% in 1995 to 25% in 2023, researchers said in background notes. However, Alzheimer's and dementia follow a more prolonged and unpredictable trajectory than cancer, making it uncertain that a patient in hospice will necessarily die soon. In fact, 20% of those patients outlive the 6-month prognosis required for hospice eligibility and will be discharged from the program, researchers said. And number 156, the Medicare hospice benefit was designed when most patients enrolling had cancer and short, predictable trajectories, and number 157, Gerlach said. And number 156, for people with dementia, whose D less than /speak C-scores can span years, we need care models and prescribing guidance that better reflect their experience. And number 157. Benzodiazepines and antipsychotics are commonly prescribed to hospice patients to manage agitation, anxiety and delirium, researchers said. However, they also increase risks of falls, confusion and sedation, potentially affecting patients' quality of life. For the new study, researchers analyzed national Medicare data between July 2015 and September 2018, during a period when hospice facilities were required to report prescriptions. None of the 139,000 Alzheimer's or dementia patients had received either benzodiazepines or antipsychotics in the 6 months prior to entering hospice, researchers found. Despite this, nearly half, 48%, received a new benzodiazepine prescription and 13% an antipsychotic after hospice enrollment. And number 148, most within days of admission, results showed. The average hospice stay among these patients was more than 130 days, indicating that many patients were not in their final days or weeks of life. Patients prescribed the drugs had a higher risk of dying in hospice than those who didn't get them, researchers found. And number 156, these early prescribing patterns suggest that these medications may sometimes be used as part of standard hospice care practices rather than fully tailored to each individual, and number 157, Gerlach said. And number 156, for many patients, these medications can provide meaningful relief from distressing symptoms, but they also carry risks, and number 157, she added. And number 156, our findings highlight an opportunity for hospice teams to regularly reassess medication use, especially early in care, when maintaining communication and alertness may be prioritized by patients and families. And number 157. Break researchers also are concerned that there is little oversight of medication use in hospice. Break since 2018, hospice agencies have not been required to report prescribing data to the federal government, they noted. Break and number 156, right now, hospice prescribing is a black box, and number 157, Gerlach said. And number 156, medications covered under the hospice BNA less than /speak fit are not reported to Medicare, so we have almost no visibility into what patients are receiving. That makes it impossible to monitor prescribing safety or quality on a national level. And number 157. Break interestingly, benzodiazepine and antipsychotic prescriptions are tracked as part of nursing home quality reporting, but the same meds aren't tracked for hospice, researchers said. Break and number 156, we need better transparency in prescribing data and support for hospice clinicians to make more evidence-informed, individualized decisions about how to best care for patients with dementia at end of life, and number 157, Gerlach said. Break sources: University of Michigan, news release, October 14, 2025. JAMA Network Open, October 14, 2025. Break disclaimer: statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek personalized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next: FDA clears new blood test to help rule out Alzheimer's disease. Break and number 148, the U.S. Food and Drug Administration, FDA, has cleared another blood test that could help doctors identify whether a patient's memory. Break: social media might stunt students' intellect, study says. Break and number 148, social media could be costing your tween some of their brain power, a new study says. Children between 9 and 13 years of age who spend more time on Break: virtual reality may recreate psychedelic-like effects sans drugs. Break and number 148, a new study suggests that virtual reality, VR, experiences designed to mimic psychedelic visual effects could safely boost creativity and flexibility. Break more news resources: FDA MedWatch Drug Alerts Daily Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break: whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.